Human papillomavirus (HPV) is a viral infection that's passed between people through skin-to-skin contact. There are over 100 varieties of HPV, more than 40 of which are passed through sexual contact and can affect your genitals, mouth, or throat. Cervical cancer, or cancer of the cervix, begins on the surface of your cervix. It happens when the cells on your cervix begin to change to pre-cancerous cells. In this video, we're going to discuss HPV and cervical cancer prevention and treatment. The video is going to be amazing, so make sure you stick to the end. Before starting the video, be sure to smash that like button and subscribe to never miss out on any of our videos. Not all precancerous cells will turn to cancer, but finding these problematic cells and treating them before they can change is critical to preventing cervical cancer. The early stages of cervical cancer don't usually involve symptoms and are hard to detect. The first signs of cervical cancer may take several years to develop. Finding abnormal cells during cervical cancer screenings is the best way to avoid cervical cancer. All countries are encouraged to introduce routine HPV vaccination into their health programs. A range of screening and treatment protocols prevent cervical cancer in women already infected with HPV. The clinical trials indicated that HPV-based screening in women above the age of 30 is the most effective option. The main problems are that the licensed HPV vaccines are too expensive for universal use and they're not targeted against all HPV genotypes. Thus, the future generation of preventive vaccines must address two main issues, such as lowering the cost of the vaccine for developing countries and increasing the number of HPV types covered in order to maximize protection against HPV-associated malignancies. Cervical cancer presents a significant global health burden, with an estimated 266,000 deaths and 528,000 new cases worldwide recorded in 2012. Approximately 85% of cervical cancer cases occur in developing countries, and they comprise 12% of all female cancers. Human papillomavirus (HPV) is necessary but not sufficient for cervical cancer, and it's also a factor in vaginal, vulval, anal, penile, and oropharyngeal cancers. There are two types of cells in the cervix: the lower part of the uterus that connects it to the vagina, squamous cells, and glandular cells. Between 80% and 90% of cervical cancer cases start in the squamous cell carcinoma. The rest start from glandular cells and are called adenocarcinoma. Early-stage cervical cancer rarely has symptoms. HPV is very common. Up to 80% of sexually active people have been exposed at some point in their lives, says Summer Dudney, a gynecologic oncologist at Rush University Medical Center. But the vast majority never develop any symptoms, and the body's immune system can usually clear HPV on its own within 2 years. You cannot always prevent cervical cancer, but there are things you can do to lower your chances of getting cervical cancer. Two vaccines, Cervix and Gardasil, are available to protect against the types of HPV that cause the most cervical cancers, as well as anal cancers in men. Your doctor will discuss the dosing schedule with you. The CDC strongly encourages adolescents to be vaccinated before they are exposed to HPV. However, even if you've already been infected with one or more HPV types, the vaccine can still protect you from other HPV types. Pap tests can detect precancerous conditions of the cervix, so they can be monitored or treated in order to prevent cervical cancer. Most medical organizations suggest beginning routine pap tests at age 21 and repeating them every few years. Reduce your risk of cervical cancer by taking measures to prevent sexually transmitted infections, such as using a condom every time you have sex and limiting the number of sexual partners you have. If you don't smoke, don't start. If you do smoke, talk to your doctor about strategies to help you quit. Various professional groups such as the U.S. Preventive Services Task Force, the American Cancer Society, and the American College of Obstetricians and Gynecologists have published cervical cancer screening recommendations. As of 2018, the HPV DNA test is now an option for primary cervical cancer screening, but the organizations have differing recommendations. No matter the screening method, it's important to stress the message of regular screening. Once a woman is older than age 65 years, screenings are generally no longer recommended as long as there have been adequate negative prior screening results and no prior diagnosis of cervical intraepithelial neoplasia grade 2 or higher. In addition to new screening technologies, strategies that increase accessibility to screening and training must be an integral part of cervical cancer control programs that are effective and context appropriate. patient awareness and educational programs that target screening refusal, treatment non-adherence, and vaccine hesitancy should be designed and delivered using evidence-based implementation approaches. Education and training of healthcare providers are also key components to improving in-country capacity. This may include adding laboratory personnel or conducting training and refresher courses on screening techniques. For example, appropriate training of general practitioners and mid-level providers in visual assessment is a very cost-effective strategy. Care delivery innovations can increase cervical cancer prevention coverage, but more data are needed on systematic implementation efforts and LMICs. For example, self-collection of samples for HPV testing can avoid the need for specialized providers and overcome barriers associated with gynecologic examinations, but may encounter other provider and patient acceptability issues. Currently, there is one licensed vaccine available in the US, Gardasil 9, a 9-valent HPV vaccine. It's approved for use in girls, women, and men aged 9 to 45 years. The 9-HPV vaccine provides protection against 9 different HPV types: 6, 11, 16, 18, 31, 33, 45, 52, and 58. Epidemiological studies have suggested that the 9-HPV vaccine could prevent an estimated 90% of cervical, vulvar, and vaginal cancers and up to 85% of high-grade cervical disease, as well as prevent up to 90% of HPV-related anal cancers and genital warts in men and women worldwide. Data from a randomized double-blind efficacy, immunogenicity, and safety study of the 9-HPV vaccine demonstrated that the 9-HPV vaccine was highly efficacious in preventing HPV infection, abnormal cervical cytology, histopathologically confirmed high-grade anogenital tract disease, and cervical procedures associated with the HPV types included in the HPV vaccine. Recently, portable thermal ablation treatments for precancerous lesions have been endorsed by the WHO to treat most precancer with lower implementation and logistical costs than cryotherapy, which remains the most widespread treatment in LMICs. The author of a 2019 review examined the dietary components that may protect against HPV and cervical cancer. They noted that the food can help protect against HPV infection. Antioxidants such as vitamins A, C, and E in fruits and vegetables, polyphenols, flavonoids, lycopene, and sulfurfuran in plant foods and teas, folate, calcium, vitamin D, nuts, and legumes. Another study in China found that a low intake of certain nutrients, folate, niacin, and vitamins B6, C, and K, was associated with a higher risk of cervical intraepithelial neoplasia. CIN2 cells are moderately abnormal cells that are present on the surface of the cervix. These cells are not yet cancerous, but they can become cancerous. Pharmacists can have a tremendous impact on HPV education and immunization rates. Currently, only about half of all adolescents are considered up to date with their HPV vaccine, and 66% of adolescents aged 13 to 17 years received their first dose to start the series. These rates are still below the goal of 80% set by Healthy People 2020 because pharmacists are readily recognized as a provider of immunizations by patients, physicians, and many national organizations, including the CDC. They should be at the forefront of providing both education and immunizations for this important vaccine. Cervical cancer elimination depends on coordinated efforts between governments, civil society organizations, industry researchers, and international agencies. It's critical to ensure that the effective tools we have for immunization, screening, and treatment can be made universally available. The call to action is an opportunity for cervical cancer elimination. It's our generation's responsibility to ensure that no woman dies of this preventable disease. New biomarker tests, which look for the presence of P16 and Ki67 in a single cell, significantly enhance the cytology process. The co-expression of biomarkers P16 and Ki67 indicates an abnormality that provides definitive information to help differentiate which HPV-positive women are at the highest risk. These women can return for repeat testing according to their clinician's recommendations. This biomarker test is more sensitive and can more accurately identify women who may have precancer than standard cytology. This improves the ability of pathologists to diagnose cervical diseases and clinicians to make treatment decisions. Unless cervical cancer prevention and control measures are effectively executed, it's estimated that by 2030, nearly 800,000 new cases of cervical cancer will be annually diagnosed. To reduce this burden, community mobilization, education, and counseling on cervical cancer prevention should be implemented at all levels. Let us know your opinion in the comment section below. This is all for today. Hope you liked the video. Don't forget to subscribe to our YouTube channel. Stay safe, and we'll be back soon with another video. Please click on the next video to watch for more health info. Thank you very much.